Welcome to the Expert Series, brought to you by the Lupus Foundation of America. Our speaker today is Sarah Gilman, owner and principal consultant at Wayfinder Health Strategies. Her work focuses on developing programs and education materials that help people understand and learn to live well with lupus and other chronic diseases. She has a Master of Public Health and is a certified health education specialist. Today, she will be speaking about complementary and alternative medicine. I would now like to turn it over to Sarah and thank her for joining us.
Hello, and thank you so much for having me here today. This is really such an important topic in the field of lupus. The National Institute of Complementary and Integrative Health tells us that more than 30% of adults in the U.S. have used complementary and alternative treatments. But in lupus, the number is actually much higher. One study found that more than 50% of adults with lupus have utilized some form of complementary and alternative medicine to either alleviate or treat lupus symptoms, and that's 1 out of every 2 individuals. So with these numbers of individuals using complementary and alternative treatments, we want to make sure that people who choose to use these know as much as possible about what these treatments are, how to find trustworthy information, and what has been shown to work for lupus thus far. So with this in mind, I've set out to answer 3 questions for people with lupus. Number 1, what is complementary and alternative medicine in the first place? Number 2, how can I find the most reliable health information? And number 3, what has been shown to work in lupus? So let's go ahead and dive right in. First, what is complementary and alternative medicine? Well, for these purposes, I'm using definitions from the National Center for Complementary and Integrative Health. And this is the U.S. federal government's lead agency for scientific research on medical and healthcare practices that are not currently considered part of conventional medicine. The first definition you need to be aware of is complementary medicine. Complementary medicine refers to either treatments or practices that are used in addition to your existing doctor-approved treatment. Alternative medicine, on the other hand, refers to the use of non-traditional treatments or health practices in place of your current doctor-approved treatment. So, for example, if I were taking Plaquenil and I also have a weekly acupuncture appointment, that would be considered complementary medicine. But if I stopped taking Plaquenil and I only attended my acupuncture sessions, that would be referred to as alternative medicine. Now, with both complementary and alternative medicine, it's very important to work in partnership with your physician. They can help you make sure that what you are planning on trying is safe. They can also help you check to see if it has any side effects you should know about or if it might somehow interact with the medicines you are currently taking. If you have stopped or are considering not taking your lupus medicine in order to try something else, please have a frank conversation with your doctor first. It's possible that your doctor may not agree with discontinuing your medication in favor of an alternative treatment, but it's important that they know that you've chosen this route so that they can continue to help you as much as possible. So now you know these terms, but you also need to know how to evaluate and select the most reliable health information so that you can feel confident as you learn more about these practices. So what I'm going to teach you now are the 4 questions you can ask to determine whether health information or a health product can be considered trustworthy. Number 1, who runs the business or site? You will definitely want to know if the organization or individual you are hearing from has the right certifications and credentials. Number 2, is the service that they are offering evidence-based? You'll want to know where the information that they are presenting is coming from. Do they provide citations to published academic research, or do they otherwise back up their claims with reliable evidence? Number 3, do they stand to make money or sales based off of their relationship with you? If they do, you may want to be a bit more cautious in terms of how you approach them. And number 4, is their information up to date? We know that research on lupus is constantly evolving, especially in the area of complementary and alternative medicine. So it's important that your information be up to date. I prefer to see information published within the past 3 years if it's available. In addition to these questions, it's also good to have a couple online sources that you know you can trust in your back pocket. As a health education professional, I generally recommend 3 online sources for people with lupus that are interested in this particular topic. The first source is the Lupus Foundation of America's National Resource Center on Lupus. The second source that I recommend, which is a little bit broader and less lupus focused, is the website for the National Center for Complementary and Integrative Health. And the third site that I recommend is PubMed, which is a free online database of clinical and life science studies. Now, this one is a little bit more complex and a little bit of a harder read, but if you'd like to see the original research papers on lupus instead of reading summaries of these, this site can be especially helpful. The third and final thing that I'd like to talk about is specifically lupus and non-conventional treatments or practices. It's most accurate to say that the majority of non-conventional treatments still need more research to support them. Most alternative and complementary practices have not been through the kind of rigorous scientific testing and clinical research that all conventional medicines have to go through. So it's difficult for us to know their true effectiveness in treating lupus. In terms of supplements, several have been studied for their effects on lupus disease activity, for their potential to reduce the need for steroids, or for their potential to protect against heart disease and bone loss. Some supplements like omega-3 fatty acids, turmeric, and N-acetylcysteine have shown promise, but far more research is needed before we can really come to any definitive conclusions. In general, with any supplement, it's important to be mindful of any side effects that these may cause, or how these may interact with the medicine that your doctor has prescribed. In terms of multivitamins, these are most likely only going to be helpful if you actually have a vitamin deficiency. If you do, it would show up in your blood work and your doctor can advise you which vitamin you would need. There is also some promise around practices like gentle yoga and Tai Chi, but these need to be further studied before we can definitively say that they will be effective for managing lupus. With both of these, it's very important to work with a knowledgeable instructor who can help you adapt these exercises to your specific needs. There's also some evidence that acupuncture may help with musculoskeletal pain and is safe for people with lupus. This is definitely an area where we'd like to see bigger studies and a bigger effect before declaring that acupuncture definitively works. But most physicians are okay with their lupus patients trying acupuncture, as long as it doesn't impact their current lupus treatment. Finally, mental health and mind-body interventions like cognitive behavioral therapy and mindfulness meditation have shown very promising results in terms of stress reduction and reduction of anxiety and depression for people with lupus. To conclude, the evidence for what works in lupus is constantly evolving. So what's most important is that people with lupus know who to trust and where to go for the most up-to-date information. And when in doubt, please don't hesitate to reach out to your doctor or a Lupus Foundation of America health educator who can help you research the particular practice that you're interested in and whether there's any support for its use in lupus. Your doctor should be a partner and a resource as you learn more about complementary medicine and what may help you manage your lupus symptoms. Thank you very much for your time today.
Thank you so much, Sarah, for joining us today and providing such great information about complementary and alternative medicine and its considerations for those who are impacted by lupus. For those tuning in, we invite you to check out next month's presentation on clinical trials in lupus. If you would like to learn more about living well with lupus, you can find additional resources on the National Resource Center for Lupus, or you can call one of our health educators at 1-800-558-0121. Finally, if you would like to connect with others who are impacted by lupus, check out our online community, Lupus Connect, where you can talk with others, find emotional support, and discuss practical insights for coping with the daily challenges of lupus. Thank you, and have a wonderful day.